I'm Dr. Ken Allen, and welcome to ISELP in Motion, our podcast that we do on a regularly irregular basis. And I'd like to welcome to the podcast Dr. Duncan Peters. Duncan, an old-time friend of mine and long-time friend, I guess the proper saying. And Duncan, you have been busy as ever, I know, and one of the reasons I wanted to get you on this podcast is you and I talk about back issues regularly, and I know it's an interest and a passion for both of us, and you have recently attended a talk called the Spine Initiative, Equine Spine Initiative, and I recently attended the ISELP neck and back, and then another meeting recently. So we've both been to a lot of talks and been speaking and listening to different speakers on the equine back. And I thought this is a great time to get together and talk a little bit about, why you think the back is important in what we should be dealing with in equine musculoskeletal pathology.
Yes, thank you, Kent. It's good to see you. And as you said, we both have attended some recent meetings that focus on that. My feeling is that it's sort of a area that is sort of left to its own devices somewhat because it's difficult to appreciate in many cases. You and I both work on performance horses and some pretty high-end performance horses. And the main thing we see is performance issues related to that, not outright lamenesses. So it's an area that has a little different background to it in terms of the concern of riders and trainers and horsemen. One thing interesting I found in doing some of the research for my talk, which was on dorsal spinous processes and the relationship there, was that we've been concerned about back problems way back from the 1600s. Some of the historical veterinary notes at that time talk about horses and problems with sore backs and dealing with sore back. So it isn't something new. I would say probably Leo Jeffcott is probably the one that has sort of brought it to the forefront, probably more in the 1980s and beyond. In terms of focusing more on the importance of the back. And there are certainly some wonderful people in terms of scientific papers out there, Denois, Sue Dyson, yourself, that have really focused on more recently the back and its importance overall to the performance horse.
Yeah, I think without a doubt we could say the back is the undiscovered country. It's an area that everyone is concerned about, talks about, but very little sometimes is known about it. I was just reading a paper recently, and the young researcher was doing a really nice job breaking the back down, and then they kind of, you could read the paragraph and they were kind of surprised that, oh gosh, we're not calling this wear and tear anymore. Now we're calling it a developmental issue. And I'm going, Jeffcott taught us all that back in the mid 70s. And, but largely the profession just hasn't grasped it. A lot of these bony issues are developmental issues that come and they're there from an early age, but they're not going to express themselves until the horse gets a little older and you ask it to do a job where it's going to bend and flex its back. We had a data group that I never got around to publishing, but it was interesting in that we had about 300 horses with back pain. And the paper in the end, we didn't publish it because we were trying to compare treatments, and multiple horses had multiple treatments, and the paper just got unwieldy. But the single most important piece of data out of that was the mean age that in our practice, with our demographic, largely English sport horses, the mean age they presented for back pain was 7.1 years. Yet it's a developmental problem that's there from 2 years of age. How do you get people to understand this process as we go through it, knowing that it's developmental, yet most of the profession doesn't know that?
Yeah, I think that's very interesting, and it's a good point. I would second that a lot of what we see of our horses that are competing are middle-aged horses that have that problem, and the focus tends to be on other issues, saying, oh, it can't be that because they're not old enough or they haven't had a problem. But like you said, it probably developed early on. Narelle Stubbs did a lot of work for her PhD, looking at actually more thoroughbreds and racehorses that showed that there were amazing changes associated with the back in 2-year-olds and 3-year-olds that had started racing, and then warm bloods that were actually at a young age. And she dissected out and looked at primarily bony problems, but misshapen problems, horses that did not have proper bony anatomy, or what we call normal bony anatomy associated with the back. So all types of variations that, again, like you said, we haven't recognized and now paying more attention to it. And I think it's sort of a hot topic right now, probably started within the last couple of years, being more and more of a concern to people. People like Kevin Hostler from Colorado, a lot of the work that he's done, and certainly, again, John Marie with his anatomical studies. Tremendous insight now coming out of these areas to help us try to break down some of these problems and go forward trying to manage them.
Yeah, and I think while we're getting started on this topic, you know, and there's a lot, just like you say, there's a lot of anatomy there, and a lot of these problems are bony. And the one, of course, we talk about all the time is kissing spines. But there's a lot more than kissing spines going on in the equine back. Why don't you give us a little bit of a rundown of where you see the anatomy, the pathology, and where you think it's most significant?
Yeah, thank you. Like you said, most people focus on kissing spine, and I think, you and I have talked before, and we've talked with colleagues, but I think that's the tip of the iceberg. Really, that's the thing that's easiest to maybe image for most people, especially with digital radiography now. But that just gives us a little bit of an insight as to what else may be going on. I think the main problems we're dealing with are more osteoarthritic and developmental changes associated with the facets, both through I primarily see it through the lower thoracic area and cranial lumbar area, and those areas move differently and have different functions. The thoracic area being more lateral movement. We talk about horses bending around the leg. Well, that's where it happens. And then in the lumbar region, we're looking at more dorsal ventral flexion, and that's where that happens in terms of, being responsible for locomotion and driving things forward from the hind end and that connection. So those are probably the two areas that we're mainly concerned about. But the other that I think is now becoming more evident is the connection between the cervical and the thoracic area, caudal cervices and the cranial thoracic area. And we're seeing not only just anatomical or mechanical problems there, but we're also seeing neurologic problems that are related to everything that affects the front end primarily there into those front legs. So, I would say those are the three areas that I probably see the most problems, and it's probably related more to osteoarthritic type changes there. The other one I'll just mention is spondylosis. I think that's certainly one that we can also image fairly well with our digital radiography. The problem with that is it's a lot more difficult to treat and deal with once it gets to a certain stage. But early on, maybe some management things or some changes in exercise programs may help to be able to deal with that a little better on a lot of horses. I hope that covers some of them, but I would say dorsal spinous processes is sort of a warning sign. The articular facets are probably where the main true problems occur with back pain that then translates to the muscles, which is what we see, and then a deep type of problems associated with the vertebral bodies.
Yeah, and I think also, just so we can make sure we don't confuse anyone, any of our listeners here, but
I can do that. Yeah.
We can both do that, but we'll try not to.
Okay.
But when you say facets and I say articular processes, we're talking about the exact same thing.
Yes,
and
I believe so.
Some of it is just an older lingo and a newer lingo, and Professor Denois is big on you and I using the newer lingo where we can. So you'll hear us say both of that: articular process osteoarthritis and facet osteoarthritis, and we're saying the same thing. The other thing that I think it's really interesting to me as I was preparing for my talks here on back and neck, and the multifidus muscle, particularly in the back, but also in the neck area, and it's really it's crossing across more than one joint space, often two, and it's a relatively small muscle, but particularly in the lower thoracic and lumbar area, it really is an important tensioning muscle. And so it does several things for us when we're looking at the back and we're doing transverse ultrasounds, looking at that articular process, is that we're seeing it through, your needle, if you're going to inject it, has to go through the multifidus. And yet that multifidus is crossing across a couple different spaces. And I know there have been some great studies where they're looking at the multifidus and trying to measure it and saying, okay, well, gosh, you can do this exercise or you can do this or this treatment and change the size of the multifidus. The thing I've always had a concern about, and I'd love your take on this, is that can you really measure it that accurately on size, cross-sectional area of it, if it's passing across a couple different joints and it seems a bit positional as to the size of it when you're looking at it? Is that your take on it, or do you have different thought?
Well, that's certainly a concern because we're looking at one slice with the ultrasound. But I know Narelle Stubbs and Dr. Hillary Clayton did a number of work with that early on, and they were very precise in terms of trying to get those horses to stand well and be positioned properly, and when they made evaluations. But it's very, very difficult to reproduce that same area and then to subjectively measure it. I think we'll probably have better techniques as we go along, and those studies probably need to be done again. And they were happening to do those with a number of exercises pre and post over a period of time to see whether there was a change in terms of that they could find. But yes, that's definitely a concern. And any of those papers that we look at that way, any subjectional type of measurements make it very difficult to compare them. Even with muscle pain or back pain, we call it. Really, when someone generally talks about my horse's back is sore, they're usually talking about muscle soreness, the longissimus muscle, which traverses down down the back. And it's usually either a cold back syndrome or, someone's brushing the horse or putting pressure there and say, oh, my horse's back is sore. And then they come and, say, take a look at this for me. Or they say he's not pushing as well as he used to, and I think it's coming from his back, that type of thing. Or he tends to be sore over his croup and his gluteal muscles up into his lower lumbar region. So there's a lot of subjectivity there that makes it difficult. I agree with you completely on that it's very hard to then evaluate some of these studies and to move forward as to what types of things may be useful in terms of evaluating some of these areas.
And another question I had for you is, we're going to talk a lot about the bony issues, which, I think we both believe are really at the crux of the matter here in most of the significant back problems that we see clinically. But there's a lot of discussion, and realistically, there are soft tissue injuries as well that happen. On the supraspinous ligament right there on the top of the back, I mean, you can see it. If there's been damage or a tear to it, there's soft tissue deformation right there on the top of the back. Sometimes that's sore, sometimes that's not. And then the other thing that people look at from soft tissue is the interspinous ligaments, which we can largely see when we shoot for kissing spines, and you can see some dystrophic calcification happening there in between the ligaments. How significant and how long lasting do you think those soft tissue injuries are?
I think those, when they're acute, I think they are very dramatic, but I think horses can sort of compensate for those over time. And actually, I was just reading something not too long ago, is if you do absolutely nothing for back pain in horses, that 62.5% of those will, over a period of within 6 to 8 months, will recover on their own. So, a lot of that is probably initial muscle problems, tears, enthesiopathies that occur, some of that dystrophic calcification then forms later on, some lysis, through those dorsal spinous processes, things like that are sort of the aftermath of that. So, in my mind, some of that we see has already occurred. And we've noticed that. You and I have definitely noted that in some of the horses we've treated. I've looked at, 3-star event horses, and all of a sudden they try to move up to 4-star, and boom, they get sore in their back, and no one's ever sort of looked at their back. And you take some radiographs and you say, oh my goodness, what's there? There's a lot of stuff there, And so we can be surprised and humbled. But I think a lot of those things have been there, as you've noted, and we've been dealing with them. But they are significant when they first occur. I think that you were talking about the multifidus muscle. On ultrasound, you look at that, and there's a lot of fibrous, dense fibrous material within that multifidus that helps to stabilize that whole area. That is different than, say, the longissimus muscle, which traverses over a large portion of the back and into the neck. So, those types of things, those variations, you have to appreciate, try to determine how long have they been there, whether they've been a factor, when were they a factor initially, and you may be able to pick that up in your history examination, sort of as to the horse having some problems at some other time. I don't know if that completely answered your question, but threw a lot out there at least.
Well, and the other thing, I agree with you. The soft tissues tend to mend themselves over a period of time, where the bony issues, they tend to be the longer lasting ones. But I've seen the same thing, and where, the particularly the old gelding that's, getting up in age. He's a mid-aged performance horse now. And you can kind of see that to a certain extent, some of those horses habituate to back pain. They just get used to it. It's another day at the office. Yeah, my back hurts. Yeah, I got to go jump this course, but nothing I haven't done before. I'm going to go do it. Where, the classic meme of the chestnut mare is that, oh, my back hurts. Oh, my God, I am not going to put up with this. And she won't sometimes. And they can get pretty interesting acting it out. What do you see in, say, those two groups as these horses present with back pain? Because it can be a wide variation on how they're presenting.
Yes, it can be very, very wide. It can be very subtle to a horse, as I said, being a little bit uncomfortable, just putting a brush on them, to some outright tossing riders, or a particular movement or a particular activity they're asked to do where they just pretty much refuse. So, I think I looked at one time over sort of the list of things that were related to back pain, and it was something like 57 different complaints that someone had put together. Anything from, internal stuff like ulcers and things like that to, complete performance issues that were alarming to a rider or to people trying to do something with these horses. So it can be so varied. That's probably a podcast process.
maybe we're verging up to a webinar even on it. And then we can have pictures. Well, and so, okay, you've got a horse and it's presenting with poor performance, stopping, doesn't want to go forward, swaps leads. I had one recently that its presenting symptom was rearing. It did it particularly when the rider was trying to mount it. It just didn't want somebody up on its back. It knew that was going to hurt. But, bucking the rider off is, of course, the classic presentation. And for years, before I started using a weighted surcingle in addition to ridden work, I would start to use that, and people would ask me why. And I said, well, people show up at my place and we do a lot of backs, x-rays and evaluations and treatments. And they would say, okay, well, our rider got thrown. She's got a broken collarbone. She shows up there in a sling. Could you put one of your people, Dr. Allen, up on the horse? And I said, I don't have that much insurance. I'm sorry. I really can't do that. But I'll put this weighted surcingle on and then we'll look at how the horse looks differently. And I think that's always one of the things that I see from a presentation standpoint is that the horse looks different lunged than it does with either a weighted surcingle or a rider up. And to me, that's the thing that just screams, you really need to evaluate the back, Kent. You really need to look closely at this back. And so from clinical signs, that's one that's always bugged me. Now, let's say we're both sitting here looking at one that to us is saying back. Where do you want to go now with your diagnostics after you've clinically evaluated it and you've got it in your head that we're going down a path toward a back?
Just a little story. When I was quite a bit younger, I used to ride a lot of these horses. I used to be that one that would get up on there and, but at that time, the back wasn't as much as a focus. It was more, there's a lameness or there's a problem somewhere. And, I would get up and ride them and try to determine that. But a lot of them I felt were back issues and not overt lamenesses or a subtle underlying lameness that you might have to deal with. But getting back to your question about where to go from there, I think one of the things we haven't touched on too much is, you've mentioned it, is that history. I think a real good listening session about the history on that horse and some of these obscure signs that people sometimes talk about is important. And so taking the time to listen to someone, rider, trainer, owner, whatever, is important. The other thing is a good clinical exam in terms of palpation and trying to determine, what muscle soreness or what soreness are they talking about versus what you're finding in terms of range of motion exercises to determine if that horse has some, underlying bony stiffness that you can appreciate, soreness over the SI region, the lumbosacral region, flexion, extension type of motions, raising, lowering the head, and then things like that in terms of palpation, whether there's any distinct soreness, like say maybe distinct soreness over the dorsal spinous process or over the muscular structures more off of midline or the specific supraspinous area, as you talked about earlier. But once you sort of determine that and you appreciate or say, okay, let's focus on the back. For me, more of a field practitioner, it's going to be X-rays and ultrasound. I mean, those are the two things that I have available to me. In the clinic situation, certainly nuclear scintigraphy is the next thing, and probably helps in terms of trying to see maybe how diffuse this problem is, or what areas we need to look at more closely for treatment. But for me, in the field or in a competition setting at some of the horse shows we do, it is going to be looking at radiography and ultrasonography.
Well, and I think that, I have the luxury of being in clinic most of the time, and so I have a big, overhead gantry, big MA X-ray machine, and that's an ideal tool to evaluate the back with. Doesn't give you the physiological inflammatory look that, say, bone scan does, but certainly if you learn to use those big MA generators and, these new X-ray systems, these new AI type systems are really amazing at helping you get wonderful radiographs of those areas. But again, takes a big MA generator to do that. You're not going to do that with a portable, even with an AI powered system. So then exactly as you say, radiograph for the kissing spines and then ultrasound for the articular processes. And one of the things, as I was preparing, and I mean, it's something we all see every day, but you really, as you're looking at that ultrasound with it, and this will be better in our webinar, Duncan, where we have slides for it. But
exactly.
Those mammillary processes, it always struck me how big they are in the thoracic area, and then how rapidly they shrink in most horses as you get back into the lumbar area. And so you have to be careful on critically evaluating that, because it's that in-between space of the mammillary process, then back axially to the vertebrae, that is the really interesting area you have to interrogate with your ultrasound, because that's where the arthritis of those facets or articular processes is going to sit there. And the other thing that always struck me as interesting, and you tell me if you see this similarly, but when I look at kissing spines, I'm looking largely at an area between T12, base of the withers, back to about T18. Occasionally a little beyond there. When I look at articular process arthritis, I'm looking largely at about T16, 17 back to L3, 4, 4, 5. Is that similar to what you're normally seeing?
Yes, exactly. I would say same indications, same things that I look at. And I think structurally or mechanically, it makes sense. I mean, you're transitioning from more of biomechanics that are lateral from that in that thoracic region, especially in the caudal, and then to more that's dorsal ventral through that lumbar area. So that's exactly the same type of thing I see.
And then since we're both ISELP trained, so our mentor was Professor Denois, we both all can use, what we've learned as anatomy as a way of getting around that back and looking at it and knowing where we are. So, to me, the guidelines have been, again, that T12, base of the withers, T15, the anticlinal vertebrae, you're going to see on your kissing spine x-rays, and then back to the thoracolumbar junction where you're going to change from ribs to transverse processes. And then when you get back to about the cranial tubercocci, you're back there in the L3, 4, 2, 3 area. And so you always know where you are. I always thought it was humorous, and I'm sure you've seen it over the years, people putting quarters with little holes drilled in them so they know the number of where they're putting there. And I always say that, I get one of those x-rays and I go, I could help this guy make more money in his exam if he wouldn't put quarters up all along the back there. So, do you have any other tricks for staying oriented on the back as you're going through it?
No, I think that's a matter of doing enough of them and realizing where you are. One thing that works pretty nicely is just some whiteout for people to put little dots on. I think that works, to give them an idea of where they are. But I think it's a learning process, and you and I are both older, and we have had the chance to look at a number of them and sort of know that appreciation for where we are. It's like the lower leg, same type of thing. Very rarely do I think in terms of zones. It's here's where it is, stick it on there, where you are on the leg because of the structures you're highlighting there. And same thing in the back. It just takes maybe a little more time, experience to feel comfortable with that.
And Duncan, if I said, okay, you've been through, you've done your clinical exam on the horse, you've listened to the history first, like you say, you've done your clinical exam, you've done radiographs, and now you're looking at a horse where you can see on your radiographs this horse had mild to moderate kissing spines. Now, so many practitioners quit there. And you've already said the next move you would do would be to ultrasound and look at those articular processes. Now, what do you do with a horse where you've got mild to moderate kissing spines, and then you go back and you've been ultrasounding through those articular processes, and you've got, say, three on each side that you're concerned about that you would say call moderate. What are you thinking about with a horse like that? Where do you think its pain lies, and what are you going to treat it with?
Yeah, I think on most of those, it lies in the bony portions down at the articular areas there. So that is the main focus in terms of treating it. And it sort of depends, dealing with the client, as to a stepwise progression, if you've got time, if you don't have time, in terms of how you want to approach that or treat it. I'm not a big one for blocking areas of the back. I have not found that useful in my practice. I know other people have, but I have not been able to isolate or feel comfortable about isolating things that well with blocking that. And other people can tell you the exact opposite. But as we've talked about, the overlap of those muscles, the overlapping of soft tissues around those areas, I think you get a lot of diffusion in those regions with putting local in there, especially large amounts. So it doesn't work for me. So I don't tend to do that. But in terms of where would I go, I'd talk with the client basically about how would you like to approach this in terms of trying to treat it. Are we going to deal with something that's less invasive maybe to start and see how the horse responds to that? Maybe putting it on some anti-inflammatories for a little while, maybe using something like shockwave over an area that, we see that, and see how the horse responds to that. If they want to get more aggressive, then I'd be looking at, some treatments, and that would be treating the areas with either corticosteroids or some of the orthobiologics. If I see that primarily 3 areas on the left side that I can appreciate, maybe 2 on the right, those are the areas I treat. I do not treat 7 spaces all the way down the back. I know some people will say, well, you have to treat the area in front where you're seeing it and the area caudal to where you're seeing it because of that overlap, because of the multifidus, the way it lines up, the segmental activity of the back. I generally do not do that. I think there are limitations in terms of what we should be doing. And, if that treatment works that I've decided on in terms of an injection, then it focuses me later on down the road to say, hey, this area, yes, I know if I treated this and the horse has responded a positive way, great. If the horse doesn't respond positively, that also gives me information moving forward next time as to how we deal with it. The other thing I'll sometimes use that, if a client doesn't want to do the injections at that particular time is maybe something like mesotherapy. I think that's been effective for me, giving some relief, and in many cases has given relief for a fair amount of time. And that's been shown in human medicine to be useful for back soreness, which is a different biomechanics I recognize. But you're probably looking at then, yes, some nerve aspects of that you have to deal with, and help break that cycle of discomfort. And I think that's a huge amount of what we're trying to do, because if we can break that cycle of discomfort and that sort of nagging pain and discomfort in the horse, then I think they can help, get to a point where they're more comfortable and tolerate it. And because you're not going to fix that, you're not going to take away that osteoarthritis that's involved there. You have to manage it in a number of ways. And one is medicinal, like we're talking about, and the other is management, exercise management, exercises, how you can change the activity of that back, the support muscles, trying to strengthen, and trying to talk people into, going other approaches with it. Maybe some chiropractics, acupuncture, things like that. So I've thrown a lot of stuff out of there, but, sometimes we're throwing the kitchen sink at them.
No, I think that's a great summary of how you go through. I think the mild to moderate, particularly, say, kissing spines, respond well, and also articular processes to, shockwave. Mesotherapy plays a role there as you get into more serious, moderate and up articular process OA. I'm a big fan of the periarticular PRP injections. I like cortisone. It worked well for years. I just found that when it wore off, which it did at a shorter period of time than what PRP tends to do in our hands, that sometimes when it wore off, it tended to have a little bit of an explosive nature to it, and where we would get the phone call over the weekend from the client who was showing that weekend and go, well, you know, that horse did really well for about 3 months, and then he bucked me off last weekend. And I was going, well, sorry to hear that. You better bring him back in. And those horses all tend to go back with PRP, because not only does it tend to last longer, but when it wears off, it tends to do it slower. And the client gets a bit more warning, but it costs more. So, you know, it's trade-off everywhere you go. And I agree with you. You know, you have to get those horses back to rehab. You have to work with them. A lot of that rehab the riders can do. You know, it's straightforward stuff. There's no rocket science. You don't have to have a whole lot of technology. And the other thing, I'll occasionally see people who will try just to go to rehab without doing sufficient treatment. And this goes back to the point you made, and I'll reemphasize that, which is you have to break the pain spasm cycle in a back problem. And if you don't do it, it doesn't matter. And if you don't do it effectively, it doesn't matter how much rehab you throw at them, you will not make the headway you probably hope you wanted to, because you have to give them a chance to not worry about that back pain. If they're worried about the back pain, you've got a physical problem and you've got a mental problem, and you're going to struggle to get through that. So, Duncan, let's go on. One of our categories we had was prevention. You know, there isn't a whole lot you can do to prevent this. If we say it's a developmental problem, in a lot of these horses, it's coming. And it's just based on their genetics, their growth, and then the job you gave them. You want them to bend their back, they're going to have some difficulty with it. So, but, you know, as we kind of look at this and wrapping up, give me a good case example, and then tell me what you really want practitioners to realize from a conversation about backs. What's being missed out there, and what are we focused on correctly?
I think a big thing is rider interaction. You know, with the horse. I think how someone rides makes a big difference in terms of that. So it's a hard subject to talk about. You know, to say, hey, the riding or the ability of the rider is having a huge effect on what's happening here. You know, things like saddle fit. I mean, you know, those things in my mind are ancillary to some degree. In some horses, I think it makes a huge difference. In others, you know, one trainer will use the same saddle on 6 different horses. Well, you can't tell me each horse's back is exactly the same. So, you know, most people ride in a saddle that fits their butt rather than, you know, where they worry about the horse's back for the most part. But getting back to your question is that, you know, I think how the rider interacts, it can play a huge role, and recognize also that their exercise management can help tremendously in terms of, you know, minimizing back pain. They can do exercises just riding around the ring every day, you know, trotting over poles or walking over poles, or small cavalettis, how they, you know, ask for collection, over collecting versus under collecting, things like that, you know, put stress, and how they build those abdominal muscles to support the horse and support the back, all play a tremendous role. So lateral work, all those things to strengthen that horse's back and make a concentrated effort to help that horse develop that area. Having horses have proper turnout, get out and let them graze and let them roll and let them do the things that they can do themselves to sort of stretch and help with either muscle soreness or back soreness. I think those things are very important, and I don't think we put enough weight on it to deal with it. We look for the fix that the veterinarian's going to make, but I think a lot of it is exercise management and rider management in terms of helping and paying attention to that. The other thing is expectations, performance expectations, and what is truly the ability of that horse to be able to do the job. And if the horse is too sore or continues to have that problem, with his back, maybe he or she just isn't able to handle that stress that we're putting on it. So we have to look at that and say, let's put this horse in a situation where they can be successful. And if they can be successful with a little bit of a sore back here and there, or some arthritic changes or developmental changes that have been there, for their whole life, and we've just put more pressure on them, so be it. But let's do that for the horse. It's going to be less problems with the horse, and we're not going to get bucked off as much. It's going to make everyone happy to have that horse be able to do the job successfully and comfortably for all of us.
That's a great sum up, Duncan. I'll give you my quick story and then we'll wrap this up. But I had a client come in and she said, well, I examined the horse. And I said, well, I think you have a back problem and we'll radiograph it here in a minute. And she says, well, okay, but my trainer told me it was probably saddle fit. And I said, well, occasionally saddle fit plays a role here. And I said, but I really want to look at the bony structures. And she says, well, do you mind looking at my saddle first? And I said, no, I'm happy to. And she just kept making a trip out to the trailer. And I said, well, can I help you? And she says, yeah, I've got 5 saddles here for the horse. And I said, why do you have 5 saddles? And she says, well, my trainer told me I should go see this different saddle fitter, and I'd go and they'd tell me they had the perfect fit for the horse and the other saddle did not. And so they'd sell me a saddle. And so I bought 5 saddles. I need to know which saddle is appropriate for this horse. And I said, ma'am, probably any of these saddles are fine for your horse. We have to actually figure out what's causing the pain and then treat it. And then you can have your choice of saddles. You can ride a different one every day. It's just amazing how the point of what's going on gets lost so easily. And as I was summing up on this talk I was given the other day on backs is I said, what I want to make a point of is you need to get the appropriate diagnosis. You need to figure out, is it really kissing spines just because you have an x-ray of mild to moderate kissing spines, or have you investigated, is it the articular processes, which both of us, it sounds like, feel like causes more trouble and can be more significant and may need more treatment. And I think that's what I would tell people, don't look for the easy kissing spine. Make sure you have learned, go to an ISELP course, go to whatever, but learn how to ultrasound the articular processes of the back so you can rule that out if you can't get good x-rays of it. Or if you don't have a big MA machine next door to you. So there's a way to get to the answer, and we don't have to let these horses suffer. And like you say, we can help the riders interact with them and do it in a manner that the horse enjoys it, the people enjoy it, the people aren't scared of the horse bucking them off. There's a way to get to the bottom of back problems, and there's a way to make these horses comfortable. It does take a little bit of work, takes some effort from us as practitioners, but it's, as you know, it's really rewarding when you can get it done. So
yes, and I'll say it does take time too. It isn't one of those things that you generally see once and you've got the magic fix or the formula that's going to do it. Each one's an individual. I've found, and the variation of pain doesn't necessarily equate to the performance issues either.
Yeah. Well, Duncan, I've really enjoyed chatting with you about equine backs, and maybe one of these days, you and I will both clear our schedule enough where we can do this long discussed webinar, and we can do it with some more pictures and have more time. But I've really enjoyed, thank you a ton for joining us and going through backs with us.
It's been a pleasure. Thank you. All right.
All right, we'll see you next time on ISELP in Motion. And in the meantime, check out the ISELP website and look when a module is coming to your area. Again, thanks. This is Ken Allen, Duncan Peters, and signing off.